Critical appraisal can be defined as the process of systematically examining research to assess its validity, its results, and its relevance to our practice before using this result of the research in the decision-making process. So we have a triad or a triangle of critical appraisal. We read the study, then we determine its relevance to our practice, its validity, and to examine the true results of the study. By relevance, we answer the question, is the article relevant to my practice and my patients? Sometimes there are a drug that is not present in your area. So this result is not relevant to your practice. Sometimes there is a new diagnostic modality that is not available to your patients. So this result is not relevant to your practice. And I am going to give you one example. The best treatment for male infertility is artificial insemination donor. Do you think that this evidence is relevant to your patient? Would your patient accept doing artificial insemination donor? So the result of this study is not relevant to your practice. So relevance means the suitability of the research to my own practice and my own patient. The validity answers the question, is the article of good methodology? Did the investigators follow the proper methodology in performing this research? This is a very important question. The results are, what is the treatment effect? What is the true treatment effect? When they say that this drug is statistically significant or statistically better than the other one, what does this mean? Does this mean that I have to use this drug, or it is better but to a very minor extent? We have to examine the true treatment effect. Validity, as I said, the degree to which the results of a study are likely to be true and free from bias, it depends on the methodological quality of the research. Again, to the anatomy of the randomized controlled study. These are the participants of the study. The first thing to be done is to randomly assign them to groups. So the first question to answer about the methodological quality, were the groups randomized, and was the randomization method adequate? But for a good research or a good randomized controlled study, randomization should be performed adequately. If there is no randomization properly, this cannot be accepted as a good study. Then, was the randomization sequence protected by allocation concealment? This is the second question. As we said before, randomization can be altered by the investigators. But if there is allocation concealment, the investigators will not be able to alter the randomization sequence, and the randomization in this condition would be properly performed. After randomization into experimental and control group, we have to look for blinding. Were the investigators and participants blinded to the intervention? So double blinding here is another important question to ask about. So the first question about randomization, the second question about allocation to treatment, allocation concealment, and the third question is about the blinding. Were any dissimilarity between the groups? Were there any dissimilarity between the groups? Were the groups similar in their characteristics? Whenever we read any scientific research, we'll find an important table in the paper known as Table 1. It usually compares between the basic characteristics of Group 1 and Group 2 patients or participants. If these basic characteristics are similar, So the two groups are similar, and the only difference is the treatment given. And so we can trust the results, that this results has occurred due to the differences in the treatment, not the differences in the basic characteristics. Sometimes these confounders are another treatment taken. A patient may take another drug with the drug studied, trying to feel better. So use of any other drug apart from those mentioned in the study protocol will alter the results and will be considered as confounder. Confounders هي اسمها بالعربي المتداخلات. Okay? Then we do the follow-up. A very important thing in the follow-up is to be similar for both groups. So the next question was, follow-up similar in the two groups? If we gave more attention to the experimental group and neglected the control group, this will introduce bias to the study and will invalidate the results of this study. And finally, we have the outcome in the experimental group and the outcome in the control group compared. Comparing the outcomes should be based on the, yes, on the intention to treat analysis. Was the groups analyzed on an intention to treat basis? If the groups were analyzed on per protocol basis and there is a lot of dropouts, this would invalidate the study, and I have to do the intention to treat analysis, considering all the dropouts as failures, and see whether this would alter the study results or not. So to minimize bias in a randomized controlled study and to do critical appraisal, always consider that you have to be ready on the paper. And to be ready, remember, R is randomization, A is allocation concealment, D is double blinding, and I is intention to treat analysis. These four are of major importance to the results of the study. If there is no randomization, drop the study. Don't take its results. Okay? If there is no blinding, if there is no intention to treat analysis, you have to do it. And if there is many dropouts, drop the study. For the allocation, concealment, and double blinding, you can only find in the study that one is missing, but not both. If there is no allocation, concealment, or double blinding, drop the study. If there is allocation concealment, but there is no double blinding due to the nature of the study, we can accept the result of the study. If there is double blinding, but the researchers did not do allocation concealment, we can consider the results of the study with a grain of salt, زي ما بنقول.